Good evening, everyone. Welcome once again to Door County Medical Center's Facebook Live, talking about all things COVID. I think we're all pretty sick of hearing about this, but unfortunately, it's just not going away at this point. I'm joined once again by my colleague Sue Powers, Health Officer and Public Health Manager. Welcome.
Thank you. I'm glad to be here.
So obviously, it's been interesting. I mean, a lot of stuff going on in the news. We've heard a lot about what's going on in Green Bay and the Fox Valley, and clearly if you look at any of the maps that show where the cases are quite high, we really are in the bullseye, and it's not a bullseye we want to be in the middle of. And I know Green Bay right now is really struggling with the amount of cases they have, and also just in general hospitalization. So we're here tonight to answer your questions and to kind of give you an update as we have it right now, and we'll be happy to answer whatever questions we can. I'm thinking this session will probably go for about 45 minutes. So please feel free to start typing in your questions. And as you can see, I kind of have a control center here. I'm trying to find a good way to do this that's a little easier to track questions. Last time it was very difficult. The questions were coming so fast and furious, I got past them. So I'm hoping that in one of the future Facebook Lives, we can go back and address some of the common themes. We did this one a little early this time. We were going to do it next Monday, but we thought since there's so much going on, if anyone had any questions, we thought it might be helpful to try and answer those questions. So, Sue, do you want to give us kind of an update from your perspective?
Sure, thank you. And absolutely, all this recent news is not easy for any of us to hear. It's not what we were hoping for. We've been in this for about 7 months. Numbers are high. We are still in the very high category for COVID activity according to the state data. Our burden per 100,000 is 659 per 100,000. To get in the very high category, we have to be above 350. So we are well in that category, and we are above the average for the state. I'm just going to comment because this question often comes up. The case numbers we report are just Door County residents, and that would include seasonal residents if they have, a Door County address. So our total case number for today is cumulative since the beginning of this is 493. We added 29 cases today. In September, we added 271 cases. And this month already, in October, it's the 8th? Yes, the 8th.
Yeah. Mm-hmm.
We've had 86, so that's almost 11 a day. And this is, as Dr. Heise pointed out, this is what is really happening throughout Northeast Wisconsin, if not across the state. Statewide, over 3,000 tested positive today, so that's another unfortunate record-breaking number. And it's safe to assume that the virus is everywhere in Wisconsin. So I've said this before, but when you go out in public, please expect to encounter COVID and adjust your behaviors accordingly to prevent contracting the virus. I can also comment on, with our cases, what are we seeing? What are the situations? What are people doing that seem to be risky? And again, it's groups. Some of them are just small groups of family and friends gathering, going to bars. Weddings is still an at-risk situation that we're getting some cases from. We've noticed restaurant and bar staff having cases that spread somewhat in the staff members. And to me, that makes sense. They do work in close quarters. Always we've had household spread, which is not surprising. And you probably noticed by the age numbers, if you're into the numbers, that we've had more school-aged kids test positive since the start of school, no doubt. We've had teachers and staff at schools test positive. But no, for the staff, there doesn't seem to be any direct links to other cases at school. We have had a minimal amount of spread within schools, so it's not It's not a big concern, spread at schools. I know that's been a question also. There's been a little spread. Across the age groups, we've had increase of cases, not just school-age kids.
Yeah.
So limiting public gatherings is how we'll stop the spread of COVID right now. This action will hopefully help us to reduce the very high level we're seeing. And I'm sure everybody saw the governor's emergency order regarding large gatherings.
Okay. Well, the questions are coming in already. Thank you so much for the questions. I'm going to try and lump some of these together. Lori had the first question. Because the hospital bed capacity statewide is dwindling, is it safe to assume that not all COVID cases are mild? However, it seems as we learn more that receiving treatment earlier rather than later helps to prevent a worst case. Before it was suggested to present if you just had shortness of breath, but are there treatments that you can get earlier? It's a good question. So the answer is, I do think we're seeing some milder cases, but at the same time, it doesn't mean that, and I know I've been saying this, and some people have sort of taken me to task on it, because I keep saying that the people that I call that are positive, they're all relatively mild cases, and that's true. That doesn't mean, though, that people can't be sick. It doesn't mean that people can't get super sick and die from this. Another question that I see on here that I'll just hit right now is the people are asking, do we have hospitalized patients now? And the answer is yes. We actually last week we had at our peak we had 6 patients in the hospital all with COVID, and that's a lot for a hospital our size. We're now down to 1. The other 5 were successfully discharged, and I anticipate the last one will be discharged as well. So that's all good news. We did have 1 death. If you look at our numbers, our death rate went from 3 to 4. And the reason that took a little while to catch up, the state kind of added it to their roles before we did, is this is a case that a patient I actually took care of, and the patient had a lot of other things going on and happened to have COVID. And it wasn't clear to me exactly how much the COVID actually played into this person's unfortunate death. But the state deemed it as a COVID death, so that's the reason for our number 4.
Good point, Dr. Heise, and I can just speak to that a little bit. People will wonder what gets the number to move up when there's a death, and if the physician who signs off on the Wisconsin statistical report that they fill out, if it's the immediate cause of death or if it's in any of the other categories that COVID is listed, then it is listed as a COVID death. Right.
And people are asking, people are curious about were they elderly, were they in a high-risk group? It's one of those things where it wouldn't be right if I were to share details, but it's at the same time not to be cagey, but I think just being private for that family. It was not an elderly person, and the person had a lot of other things. We talk a lot of other medical issues, comorbidities, as we say. And it just speaks to the fact that, people that have comorbidities can get very sick. And again, I know I don't want to talk out of both sides of my mouth. I want to be as transparent as I can, because this person had a lot of other things going on, and they happened to have COVID. I'm still not convinced that COVID played a huge role in this person's death. But in the end, unfortunately, it's still a tragedy. It doesn't matter. Someone passed away of a severe illness, and it's a shame. So hope that's not too cagey. I will say that if you guys are seeing this like I'm seeing it, there's all kinds of bots on here, and this thing where it comes up, and that's getting in the way of a lot of questions that I'm trying to look at. So I apologize if I'm not getting to it quickly enough. Here's a question for Sue. Should the county be taking more strict measures, that is, like shut down more restaurants and bars, possibly other businesses for the next 2 to 4 weeks? Any thoughts or take on that?
So I'm not sure if everyone is aware. You can go to our website, the doorcounty.gov, and go to the COVID information. We did put out an emergency alert yesterday, and basically we did that to add strongly encourage some new mitigation strategies. And as you know, the governor put out the emergency order for limiting public gatherings. But we encourage everyone to simply avoid indoor gatherings outside your household and to limit any outdoor gatherings to 10 or fewer where physical distancing, with physical distancing and face coverings, and for sure to avoid any gatherings, including family events where distancing and masking aren't practiced. We encourage postpone or cancel all non-essential activities and events and travel. So that is what we strongly encourage.
And I think, I think aside from those recommendations, I think the big thing, just speaking personally, when I go to the grocery store and things like that, I do not go out in fear of getting COVID. Why is that? Because I wear a mask, and I try and stay 6 feet away from people, and I wash my hands when I'm done. And I really think I've been doing this since February, since this whole threat started, and I have yet to get COVID. And I think I really am convinced. And masks are not a perfect solution. There's not great science that says that it actually helps. There's a lot of great anecdotal, I won't say evidence, but a lot of great anecdotal stuff that talks about getting in less amount of virus if it does get through the mask. So I just think that's a great place to start. I think being indoors in congested settings with other people, that is the single biggest risk. Poor ventilation, being indoors with a lot of other people. So those are the key things if we can avoid doing those things. And by the way, we're not saying do this because it's going to necessarily fix anything, I guess I'd say. The big thing is that we can mitigate and we can start to drop this spread of the virus. Because again, I keep saying this, viruses live for one thing only, and it's to replicate. So if you get in the way of that replication cycle, the virus can't propagate. That's why you've heard people say, they look at things and they say, well, if 80% of the people wore masks, we could drop the spread of this very quickly. And I think what we are seeing, especially in the north central part of the state, is there's a lot of division as far as people saying it's my right not to wear a mask, I'm not going to do it. Well, we're seeing what the result of that is. Let's see. Here's a good question from Lori again. So at what point should you go to the doctor or the hospital if you have symptoms? The time that you should go to the hospital or your doctor, or at least call and ask, is if you have COVID and you begin getting short of breath. If you're quite short of breath, you're having a hard time catching your breath, that's a good time to get checked out. As far as going into the ER, there's really nothing that we can do to treat the disease sooner than if it gets, how do I say this? Basically, we don't admit you unless unless it's fairly severe disease. And by severe, what I'm talking about is an oxygen level, we check pulse oximetry, less than 94%. If it's less than that, we need to give you oxygen. That would be a time that we would admit you, and we would think about doing the other modalities like you heard the president have, dexamethasone in some cases, remdesivir, which is an antiviral, and potentially convalescent plasma. So that's what we would admit somebody for. Short of that, if you're just feeling plain lousy, which a lot of people are, body aches, fevers, not even fevers, just fatigue, things like that, getting plenty of rest, maintaining your fluid intake, that's the single best thing you can do. Now, Sue, someone asked, which is a really good question, can we clarify why is it that we tell people that they should quarantine for 10 days when they're positive and 14 days when they're a close contact?
Yeah, very good question. So if you are ill, you need to isolate. So isolation and quarantine are two different things. Isolation is for someone who's ill. And I remember that because ill starts with an I and isolation starts with an I. I get confused too, but now I have it. Anyway, what we know about COVID is that after about 10 days, if your symptoms have been resolving and you have 1 day of pretty much resolved symptoms, significantly decreased, as in no fever, and maybe you still have that loss of taste or smell, that doesn't qualify to keep you in isolation. But if the other symptoms are gone, maybe you have, I don't know, a mild cough lingering, you can be out of isolation after those 10 days, including one of resolving symptoms. We know that that's how the disease works. Quarantine for 14 days is because, and quarantine is, you are been exposed to COVID and you may develop symptoms, so we want you to stay away from others so as to not spread it, because we know that you're able to spread it for at least 2 days before you become symptomatic. And we know that the incubation period for COVID is for up to 14 days. So at any time in those 14 days, the viral load could become high enough to either let you test positive or become symptomatic or both. So that's the reason for the 14. And it doesn't seem fair that the ill person gets to be off the hook sooner than the quarantine person.
Yeah, and that's you know, and I'm a pretty plain talker, and that's one of the things I'll tell people often is, you know, being a close contact really sucks, and it is really that's the worst place to be, and I was one. You know, my son was a close contact, and then he tested positive. Thankfully, he had no symptoms whatsoever, never did, but I was a close contact, and so then you have all this quarantine that you have to do. Yeah, that's sort of the last place you want to be. And by the way, that's kind of the point when people say, you know, I want to do my own thing. I'm okay with. I'm not going to wear a mask because if I get sick, it's on me. I'm okay with it. I'll deal with the consequences. What I think people miss when they say that is, if you end up getting it and you test positive, then the next thing that happens is we look to see who were you close to. Who were you within 6 feet for 15 minutes or more? And that ends up being sometimes 20, 30 people. And you have now affected the lives of 20, 30 people very adversely because you were good for it on your own. So, you know, that's not a good way to make friends and influence people, that's for sure.
I'm going to follow up on what you just said about contact tracing. Is what that's called, of course. So as we talked about last week, public health, we have modified our approach to contact tracing. And what we are doing is contacting the positive case after Dr. Heise or Dr. Fogarty notifies them of their results within 24 hours. And we have been able to do that. We're getting caught up. So I'm very pleased about that, because we instruct the positive case in isolation. And then we talk about their household situation, who lives with them, and their other close contacts, and help them identify who might be at risk, who their close contacts were. And we give them quarantine information to pass along to those folks. It's working out well. What we ran into before is people were reluctant to give us the names and phone numbers of their close contacts. They felt like they were ratting them out somehow, which was certainly not true, just wanting to protect them. But or people would say to us, okay, I'll give you the phone number, but I want to call them first.
Yeah.
So kind of, you know, we were both doing it. We provide them written information by email to pass along. This change has also allowed us better capacity to work with our business partners that have cases at their businesses and our schools. And so to get a better handle on those clusters of people with testing positive and to prevent further spread in those situations. So it's working out well, I think, for our community as well as for public health.
Yeah.
So, and we could go back to a more active role in calling the close contacts, but for now this is working, and for the sheer numbers right now we could not keep up. And as Dr. Heise said, it could be 20, 30 people, and that just is really difficult for me to understand. Of course, I'm in this every day, but with COVID, none of us should have that many close contacts right now.
Right. Let's see. Oh yeah, someone had asked, and there's a bunch of other questions I want to get to, but someone had asked, kind of a hot topic that I've heard a lot today in the last few days is, can you describe what the surge plan for the hospital is? And I know that was referenced in the news release, press release from the public health. And there's really no surge plan that we're doing now that's different than before. It's the same thing. When this whole thing started, we basically sat down and said, okay, what are we going to do to be able to serve the community and take care of people if they become quite ill and if they need to be hospitalized? So the bottom line is we have, we are all set for basically almost anything that comes our way. We can increase our physical, from a plant perspective, hospital perspective. We're a 25-bed critical access hospital. We can double that physically, but usually not just our hospital, but many hospitals all over the place. We're seeing it in Green Bay. The limiting step is staff. As it's like the conversation early on in this pandemic about ventilators and do we have enough ventilators? Everybody wanted to know how many ventilators did we have, and I said we've got tons of ventilators, but I've got 10 ventilators. I can staff about 6 of those. Thankfully, we have not needed a single ventilator throughout this entire situation. So that's sort of become a less of an issue. So same thing. So there's really no new surge plan. There's nothing fancy about it. We can certainly take more than 25 people. Generally, even with all that's going on, it hasn't really been an issue. But I have every confidence that we can take care of our community. So let's see. That's my best.
I'm glad to hear that, because I don't think the Green Bay hospitals are,
well,
in great shape.
Yeah,
I think
I think every hospital is at risk of that. I mean, ours too. I mean, I'm not trying to blow sunshine. I mean, it's there comes a point, even in the biggest hospitals, there comes a point where you cannot take any more people. And someone had asked a question earlier on: would we be sending people down to the I forget what they call it, but the facility that the governor mentioned down at the state fairgrounds in Wauwatosa. And the reality behind that, I had a conversation this morning with the regional folks from the hospitals in Green Bay, and the criteria for admission there, you pretty much have to be well to be admitted there. Not to take anything away from the effort that's being put in there, but you have to be almost ready for discharge from the hospital, because you have to be you can't be above a certain weight, and you have to be on a minimal oxygen, things like that. Plus the fact, let's face it, we're 2.5 hours from there. So how do you transfer large numbers of people from here to there when it's a 5-hour turnaround? So it's good to have that as an option. I just hope we don't need it. Let's see. Anything else you want to do, a song or dance something while I look at questions?
Feeling unprepared right now.
I heard the only reason Green Bay hospitals, I'm sorry, I interrupted you.
Go ahead.
I heard the only reason Green Bay hospitals are so full is because nursing homes aren't letting their residents back in. Not really. That's not really true. Getting people back into nursing homes is problematic, but generally speaking, our experience here has been that if you are in a nursing home and you need to be hospitalized, they're taking the people right back. It's more an issue with COVID, with the cases being so high, of actually the nursing homes accepting new residents, especially if they've been COVID positive. I think what we're seeing though, and here as well, it's not, in Green Bay they're seeing a surge of COVID hospitalizations. We saw a little small surge last week, and that recovered pretty quickly. We are just immensely busy with general hospital patients. I mean, this the usual stuff that we take care of. People that have emphysema and have pneumonia and have all kinds of different things that aren't COVID. I mean, one of the reasons I'm in the getup I'm in is I sat down just before we started this because I'm working in the hospital right now. But we're not full, so don't sweat that. Someone asked approximately how many have tested positive since October 1st. I don't know that I can answer that. I don't remember.
I can.
Can you? Oh, perfect.
86 that
Okay.
we have, right. So that's quite a few for 8 days for us.
Tracy asked, after testing positive, how long are we immune? I keep hearing conflicting stories. I think the reason you're hearing conflicting stories is we just don't know. I mean, I think if anybody gives you a candidate amount of time, there's no good evidence that says exactly what. We assume, based on our understanding of immunity following a viral infection, that there's some T-cell immunity and things like that. We assume that there is a period of time. I think, I don't know if this came from you, from Public Health, Sue, with kids in school, there's this concept that they've got 90 days after they're positive, meaning that if they develop symptoms, they're probably immune and it probably isn't COVID. That's probably a really reasonable number, but again, it's a shot in the dark because we just don't know yet. I mean, all these questions that we have when we look back at this a year from now who are going to say, oh yeah, well, we thought it was 3 months, it really is 1, or it really is 6. So we'll have to see.
One of the parameters we use, and this is from the state, is that if you have recovered from COVID and you're re-exposed within the first 90 days, you don't need to re-quarantine.
Okay.
So that speaks to, they seem to feel you're immune during that time.
Yeah.
Yeah.
Judy asks, if a bar or restaurant are not compliant, what can be done? I don't know what can be. I mean, I'll answer, and then I'll let you say from the public health perspective. What I tend to preach is I really believe that masking helps decrease the spread. And so from my perspective, if I go into a local business and they are obviously not masking despite the governor's mandate, whether you believe it, whether you agree with the governor's mandate or not, it's there. If you go in there and people are not masking, the staff is not masking, they're not obviously social distancing, my advice to you is to turn around and leave. That's just the best, smartest thing to do. And then you also have to question, why would people do that in our community? I mean, we're a small community. We do have a small hospital. I think we need to make sure that we're safe. I firmly believe people can have businesses open and do their business without having to cram everybody in. I know we'd rather cram them in so we could, be able to keep our employees going and that sort of thing. But this is hopefully short term. And so that's my take. So I'll let you talk from the public health perspective.
I liked your answer very much. Mm-hmm. I think you're spot on. Mm-hmm. I mean, don't stay in the restaurant and try to change that situation right then. But we have been following up on complaints that we receive regarding situations, and our first approach, of course, is education. A second approach, if needed, it could be if we get multiple complaints, then we can issue a targeted health order and a citation through our corporation council. As far as Governor Evers' emergency order number 3 from this week with the limiting of indoor gatherings, I suspect we're going to take a similar approach at the county level. We haven't worked out all the details yet, since that's not in effect. We'll finalize that tomorrow. But education is always our first approach. We do keep a running list of businesses and how many times we've spoken with them regarding what and what the results were and who we talked to and all of that. And it's unfortunately a growing list.
There have been a bunch of questions I'll try and address about testing turnaround time and the fact that it takes too long. Some are saying, there's one person saying, yeah, test results are taking too many days in Door County. Tests at Bellin and Green Bay are about a 24-hour turnaround. And that can be true. So I'll just kind of, not to bore people, but I'll just kind of go through how our testing situation works. So first of all, we can always test someone. So if you ever hear a rumor that, well, a machine is down or something and we can't test, that's not true. We always have ways to do that. One of the reasons that turnaround time can be low is that depending on, we try to prioritize the patients that we need results sooner rather than later. And that a lot of times has to do with degree of how many symptoms, if they're going to be in the hospital, if they're schools children, if they're healthcare workers, if they are EMS workers, fire department workers, things like that. We try to prioritize those. For those that have mild symptoms and come in, sometimes what we need to do is send those tests to a lab around Madison called Exact Sciences. It's the same lab that Prevea uses as well, and I think a few others as well. That's kind of what the state has contracted. Now they're changing their labs, as are we, to do some of those. Those can take 3 to 5 days. If they're super busy at Exact Sciences, it can take up to 7, which I agree with someone that said it is entirely too long. It makes it very difficult for us to do anything meaningfully with those results if it's that far out. Our goal here is to do all tests in-house and try and have a turnaround of less than 48 hours. We have a device that we have unlimited ability to get test equipment for, testing modules for. Unfortunately, when you have a machine running 24/7, it's like if you ran your car full out for 24/7 for a week, your car would at some point burn out and require an oil change. And that's kind of what we've had to do with the device that we have. Now, We have several different modalities that we're using. They're all the same kind of test. They're called PCR tests, which is the same that everyone basically around is using. There's just like anything else, there's different vendors, different brands that we can run. I always use the example, we have an in-house test that's our most rapid. It's about an hour turnaround. The company is called Cepheid. Those companies put forth an allocation of testing supplies, not just here, but everywhere. So an example I use kind of facetiously, but there's a lot of truth to it, is I'll say, I'm going to write a check out right now and I want 10,000 tests. And they say, okay, thank you very much, here's 30. And that's about what they do. And it depends on how large the hospital is, it depends on where you're located, it depends on a lot of different things. So our lab director and our lab staff has done an amazing job trying to find new ways to be able to test. And I anticipate that by the end of this month, we'll be able to continue to do things pretty much in-house. So our goal is to get that turnaround time less than 48 hours. And when we start doing antigen testing, which is more just the spit testing, that'll be less than an hour. But all tests are not equal, and we need to figure out how best to use the tests that will give us a result that we can act on appropriately. So you think that was kind of a lot, but
That was good.
did you get? Yeah. I know it frustrates me so much when it takes a long time, but for me it's like, it's not for a lack of trying, not for a lack of desire, not for a lack of resources, it's for a lack of literally not being able to get the testing supplies in because of allocations and things like that.
There's no one reason why a test would take so long. I think that's you covered
that's
well.
a good way.
There's a variety of factors that come into
exactly.
play.
How long will visitor restrictions at the hospital be? For the time being, that we're going to continue. I don't have a good sense as to when that will stop. Here's a good one. Sue, can you please clarify how the daily numbers are calculated? Some days it seems as though the new positives minus the new recoveries don't match the change in active cases. I think I know the answer, but...
I'm not sure I understand the question. The new positives are different from the new recoveries.
I think what they're asking is that if you have so many new positives and then these recoveries, then there should be, if we have active cases and then recovered cases and then new positives, there should be a mathematical relationship. And I think, correct me, I think what we're talking about is, I think the definition of recovery is a little different. I think recovery, how do you define recovery?
How I defined it before, if you're able to be out of isolation.
Okay.
So
I think with testing coming in at variable times, I don't think it's necessarily a mathematical correlation day to day.
No, there is no correlation.
Yeah.
Because not everybody recovers in that time frame
Right.
and gets taken off that list.
And it's a really good question, and people have asked that, and I know, and I've asked myself the question, and that's why I think that's why, because recovery it's a variable test, come in at different times of day, different days, and so.
And we may not be able to finalize out that case for one reason or another, and then it doesn't get on the recovered list.
Okay. Sorry for the silence. I'm just trying to look at the questions here. People are talking about 25% of capacity. Is that set by the fire code? Is that how capacity is come up with? People are sort of asking. Yeah, each business has a fire code. Kelly asked the question, if you don't have insurance, good insurance, how much is a test now? I'll have to admit to being ignorant to some of that. I think we're still in a situation where your insurance can be billed if you have insurance, but in general, I think most are set up where there's not an out-of-pocket for testing. I could be absolutely wrong on that, but I don't think I am, because I think it's in the government's best interest, our all best interest, to get tested. So that's my understanding. If there's been a change, I apologize for giving wrong information.
I think you're correct.
Yeah.
I'm also going to throw in about testing. We do have plans with the National Guard for them to come up and do testing on, it's preliminary, it's not ironed out, either every week or every other week at the Sister Bay Fire Station, and hopefully that will begin in a few weeks. Yeah.
And we're trying to lobby to get them to do some down closer to here too, because I'm thinking we'll see how the response is up north.
Yeah.
Jamie asked, what's the percent positivity rate right now versus the state? Do you have those numbers in front of you?
I do not, and
Okay.
I'll be honest, when we calculate the positivity rate, and you helped point that out yesterday, it is different from what the state calculates, so I just stopped there.
I think it's.
You know.
I think right now, we're going off of the one that really is meaningful is the 14-day percent positivity, and I think it's in the 13-14% range. I'm not sure what the state is, to be honest. I haven't had a chance to look today. It's been so busy. I think obviously anything greater than 5% is problematic. So
I believe it's over that, right?
yeah.
For those of you that love data, if you haven't been to the Wisconsin Department of Health Services website lately, they've really stepped it up, and you can drill it down to county level on many things.
Someone's still confused about the earlier question. If you test positive, why is it you can only pass it on for 10 days? I think the reason is when you're positive, presumably you've had a few days of symptoms beforehand, and so in the end, there's about a 14-day window that you could get it, have symptoms show up, and then it's 14 days seems to be about the life cycle of this. And so the way that I process it in my brain, and Sue can chime in, is once you've tested positive, you generally have had an antecedent amount of time. So you've had symptoms, you get tested the day later, 2 days before that is when you probably were positive. So you add that up, you probably are in a 14-day area, whereas if you're just a close contact, you have to assume that, okay, I've gotten tested because of being in close contact. Now, I could potentially get the disease from day 0 to day 14. So day 10 wouldn't be enough because you could develop a positive test at day 12 or develop symptoms at day 12. Does that sound about right?
Right. The course of the disease is a different, really, time frame than the incubation period.
That's even better. Even better said, yeah. Okay. Let's see, looking through the bots again. Does the governor's order pertain to government meetings?
They are exempt.
I thought so.
There are some. If you go to the governor's order, there is an accompanying frequently asked question. And religious gatherings, government, schools are exempt. Healthcare.
Yeah, there's a lot of exemptions. Mm-hmm. If you actually read it, it's not a long read. I mean, there's quite a few.
Right.
How many positive cases are in Door County today?
As in active?
Well, just like, what's like if you looked at the positive cases, how might?
You know what? I did not write down that number.
I know it's over 445, at least from our perspective.
Oh, you mean the cumulative
Yeah,
positive?
yeah. Totally,
I thought you meant active.
Oh, I'm sorry, not today.
No.
Yeah.
Yep, 493.
Oh, okay.
Yep.
It's even more.
Cumulative, yeah.
Okay. Colin asked, are there any new developments with regard to vaccines or treatments? I haven't heard any more than anyone else as far as that's concerned. I know, people tend to ask me, are you going to take the vaccine when it comes out? And I say, absolutely. The only thing for me that's important is it has to have gone through phase 2 and phase 3 trial, or phase 3 trial, sorry, not phase 2. It has to have gone through phase 3 trials because that's the level that you have a better sense of how well the vaccine's going to work and if there's any problems with it, things like that. So that's the best I know right now. How quickly are schools notified of a positive by a student or staff? Pretty quick. I mean, as soon as as soon as the result comes back. Right now the way it's set up, at least the testing that occurs here at Door County Medical Center, I call all the adults that come back positive, and Dr. Amy Fogarty, our Chief of Pediatrics, calls the children. So we try to call right away. Sometimes I will admit that if I get the phone call of a positive at 6:30 in the morning, I probably won't call till about 8. Not so much for me because I'm here, but because if I weren't here working, I would be in bed. So that's why I wait. So that's,
And I'll just comment that usually the schools are aware before public health is, and we get notified right away. So the schools get notified by the parents and or Dr. Fogarty, as I understand it.
Yeah. Someone had said a minute ago, and I want to make sure I get to it. I'm forgetting already. Oh, somebody was asking, can you explain why masks not only help? Oh, I know what it was. Somebody had asked about, does it seem that there's maybe a mutation happening with the virus, that because I keep mentioning that they're less severe? And I don't know the answer. I mean, it's possible. Viruses mutate all the time. I mean, that's and what mutates on a virus is not so much the virus, the RNA itself. It's actually the spike proteins on the outside that mutate. So that way, if the body has come up with a way to stop the spike from latching on and getting into cells, it will mutate in order to get past that. So, you know, viruses are pretty smart little critters, and they're able to make mutations to continue to try and survive.
It would be great if that was the case. I don't know that we can depend on that, though.
You can't. That's the thing.
You don't know if you're going to get the severe.
Right. That's
right?
just it. And that is the hard part about all this, is that, you know, when I tell people that the people that I've talked to have had mild cases, or at least what I call mild, they feel terrible, but they're not coming into the hospital sick. That's not to say, oh, good, we can all be relieved and go on about our business. That's more to say, let's be thankful that's the case. And the hard part is you just don't know when some of these people will turn around and get quite sick. Boy, we've got 48 questions.
Or when that person would spread it to someone who would get quite sick.
Exactly.
That's what's happening. Yeah.
Let's see. How does a flu shot affect you if you have COVID and don't know it? Should you have a COVID test before having the flu shot? You want to take a stab at that?
Wow, that would be a hard one to answer. I don't know the answer to the first part, but to the second part, you should not get a flu shot if you have any symptoms at all. As far as the COVID test, that does not sound practical.
No, I think if you know, generally we say with getting an influenza, any vaccine, if you have a fever or if you aren't feeling well that day, don't get the vaccine on that day. Reason being is you don't really know if it's the sickness you have, or you know, if the vaccine is causing sort of an errant fever. But I would encourage everybody to get the influenza vaccination, because that's going to really help us try and sort of try and parse out when people come in with respiratory illness, the symptoms involved with COVID and influenza and even the common cold, and sometimes allergies, have a remarkable similarity. And so we're going to use different testing modalities to try and parse those out. If someone is sick enough to end up in the emergency department, we will have testing to be able to tell us with a single swab, is it COVID, is it influenza A, influenza B, one of those, or is it none of the above? So that'll help. But in the meantime, getting your vaccination will help, because odds are good you won't get influenza if you're vaccinated. And so that sort of takes that out of the equation to some extent.
We had our first drive-through flu clinic today on Washington Island.
Oh, great.
I didn't get to go, but reports are that it went smoothly. So if you're interested in getting flu vaccine from us, visit our website for the dates and times. I know Door County Medical Center is also doing flu vaccine, and you can get those by appointment, I believe. And thank you to our EMS partners who have really been great. They're helping us with our flu clinics this year, as are volunteers from the Fire Association, and we really appreciate that.
Someone had mentioned they were at a business and saw people wearing face shields only, and that's maybe a little better than nothing, but unfortunately it's not been shown to really be as effective. And again, someone had asked a minute ago, can you talk about the mask concept? And again, the idea is, we call it the inoculum, how much of a virus that you would get if you didn't have a mask on. You'd have unfettered virus going into your nasal passages and maybe into your mouth. If a mask is on, you do have a bit of a barrier, so there is a barrier effect. So the concept is if I'm wearing a mask and you're not, I still am better off than if I didn't have a mask on. If we're talking and both of us, as Sue and I, have masks on, the odds are good that we wouldn't spread it. It's not, the odds aren't zero, but it's much better. And even if we did, if I spread it to Sue or vice versa, the amount that we would get would be quite a bit smaller. And I think that I think it's pretty clear there's a dose effect here as far as how sick you get. Again, not substantiated by hard data, but I think that's a hypothesis that is being studied and looked at, and that's kind of the problem with science. I think, and not a problem, but that's, I think, for people that don't work in science or aren't science oriented, is this concept of, well, how come you don't have any answers? Well, the reason is because we have a hypothesis. We have to test that hypothesis. We have to be able to get the results repeatable multiple times, and then you can say, yes, this is true, as opposed to a one-off where you say, well, I ate carrots last week and then I got sick, so carrots must have made me sick. No, it's the whole correlation versus causation phenomena. Let's see. A couple people have asked the question, I don't want it to go unanswered. Why are the high schools still playing football? It's just a choice that they've individually made. Okay, I think I want to make sure that I've hit all the high points here. People are talking amongst themselves as well, which is terrific. There was let me rephrase, if one gets tested because they have been exposed, but they don't have symptoms and they come back negative, what's the protocol for returning to work? So let's just say it's a close contact. Mm-hmm. Can you speak to that?
I sure can. A negative test does not get you out of quarantine. You still have to fulfill those 14 days. So we would ask that you do not return to work until day 15. And it is entirely possible that you test negative on day 7 and then become symptomatic on day 10 and test positive at that point.
Oh, here's a good one. I hadn't heard this. Thoughts on the state saying you have to put a mask on and off between bites of food in a restaurant. I haven't heard that one.
I do not think they said that.
Yeah, but it's
that sounds rather impractical.
Yeah, it is. Yeah, I mean, I think you really just have to decide if even with spacing and stuff, you just have to decide if that's a level of comfort for you if you want to go out and eat. I know my family and I in July went on a short vacation out to Colorado, and we did a couple of takeout nights at our hotel, and then we did go to a restaurant 2 of the nights, and they had spread out nicely, and I felt very comfortable. So I think it just depends on your level of comfort. We talk a lot about risk in COVID and things like that, and I think humans in general don't do a good job of assessing risk or sort of deciding about risk. I think we're worried that, oh my God, if COVID's here, we're going to die from it, or maybe the other end of the spectrum and you think it's no big deal or it's a hoax. So I think you just have to decide your level of comfort, and then when you make that decision, do what you can to protect yourself, like wearing a mask and things like that. So I think if you're sitting, even right here, if I'm sitting at the computer, if I took off the mask and started looking this way, odds are good Sue isn't going to get it, at least as far as we know now. Someone else had asked the question about, the CDC has kind of been on again, off again about, is this aerosol or is this droplet? Mm-hmm. We've been operating on the assumption or the presumption that it's droplet, because that seems to make the most sense. Is there some aerosol transmission? I would not be surprised, but it would seem to me that if it were truly aerosol, we'd have a lot higher case counts and a lot higher morbidity and mortality rates, because it pretty much means that if it's aerosol, it's everywhere. You're in the room, and if you have your mask off for any length of time, you're going to get it. And that's not what we're seeing. So I think that's why the CDC has been a little bit up and down with that, because it's not been well demonstrated. But I think you always have to, as Sue has said on many occasions, just assume you're going to come in contact with it. And you can you should choose the smart way of how to come in contact with it, which is with a mask on.
And I think it's tough because it's invisible,
Yeah.
right? And we're tired of this, and I don't want to do it anymore.
Yeah.
We just would like to go back to normal, but now is not the time to throw up our hands and go back to normal.
Let's see. Yeah, Linda has I get this with fair frequency. Several people I know were recently exposed, had no symptoms, they tested negative, and they were told by DCMC they could go back to work the next day. I don't know. I mean, usually when people say, people I know, I've heard from people I know, not to diminish what you're saying, Linda, but I guess I don't know the specifics. But we get that question even here with employees amongst the hospital is, wait a minute, are we supposed to do this or not? And, when you're in a hospital situation, there is a critical staffing scenario where, because we do this for a living and we wear protective equipment in the job that we do, we may not need to stay home for that 14 days. As an example, when I was quarantined, I came to work and I wore a mask and I took precautions and tried to stay, in meetings I stayed 6 feet away from people because it's a critical shortage thing. I'm one of 3 hospitalists. And so that is the important part about that, though, is when I go home at night, when I did go home at night when I was under quarantine, I didn't go anywhere. So I was quarantined for the 14 days. I came to work, did my job, had protective gear on, but I didn't go anywhere. So that
I'm
might
very
be,
glad to hear that.
Yeah, well, that's kind of
I didn't doubt it, but
yeah, that's what the
that's how it should.
That is what the advice is you really, just because yes, there are some situations where you can go to work when you are under quarantine for critical shortage type jobs, but that doesn't mean when you're done you can go have a romp around Walmart. Wouldn't be a good idea. I think we're at 6:52, so we're going to do 3 more minutes and then we're going to call it quits. This has been really great. So many good questions. And again, I just feel like I have to apologize because they come through so fast and trying to register which ones and the sort of the commonalities. So I'm sure if I missed yours, it wasn't intentional. Someone just asked a question, Carol asked, isn't this just like the flu now if it's in the air, quote unquote, then it should just become part of life? The interesting thing, what I'll say about that is the difference between influenza and COVID is influenza, if you don't have symptoms, you don't have influenza at that point. By the time you're symptomatic, you may have influenza. So it's not a situation where 3 to 5 days before you have the flu, you can be spreading it to everybody. So usually when it becomes apparent and you're infectious, you've got symptoms and that's when you seek care. COVID is very different. You can be totally asymptomatic, period, never get symptoms. You can be pre-symptomatic. You can have days where you have no symptoms and all of a sudden you get symptomatic. And those days, either pre-symptomatic or asymptomatic days, is when you can spread it around like typhoid Mary. And that's a different thing than influenza. Does that sound right?
It sure does. And
Okay.
the other thing about the differences is influenza has been around a while.
Yeah.
And it's been studied extensively. And
Good point.
we know a lot more about it. And COVID is still very new.
Yeah. Melanie, this is probably a good last question. Melanie asks, what do you suggest if you've had symptoms on and off for months? My guesstimate is it's not COVID because it doesn't hang around that long. It's going to make itself known or it's going to go away, generally speaking. And that's a really good question because a lot of people have asked that. I've sort of felt kind of punky on and off for the last few months. What do you think? And it's hard to say specifically what it is, but it does not follow the pattern of how COVID tends to work. We have not seen a lot of documented cases of reinfections, of I had COVID, it went away, and then I got it again. We haven't seen that. I mean, I don't think there's 0 case reports, but we haven't seen that to any great extent. So I wouldn't expect that recurring symptoms for months would be COVID. Well, thank you so much for joining, Sue.
Thank you.
Always good information.
I think we started out, and I did not say the usual, please distance 6 feet away from everyone and wear your mask and frequent hand washing and all those things that we're all really tired of, but I hope have become habits. because your individual decisions and actions affect the whole community right now.
Absolutely.
Yeah.
And I'll close with you probably have heard me say this, and it's kind of droll, but I always say, this too shall pass. It may pass like a kidney stone, but it too shall pass. Have a good night, everyone, and stay well.